to make sure that these symptoms are not due to stroke, for example, we can investigate the patient. And one of the best way to investigate a query stroke patient is by having CT brain scan. CT brain scan is available everywhere in the hospitals, and it is one of the very useful radio imaging investigation to make sure that there is no clot in the brain, there is no brain ischemia, and there is no brain hemorrhage, for example. If we can rule out a brain hemorrhage and clinically the patient present themselves with stroke, with clot formation, then this can be treated with clot busting medication. But the doctor needs to be absolutely sure that these symptoms are due to stroke itself and not to any other diseases. So CT brain scan can be first line radio imaging investigation in cases of stroke. Of course, taking blood from the patient, making sure that every other biochemical blood investigations are within normal range. There is no contraindications for thrombolizing the patient with the TPA, with the clot busting medication is very important as well. And accordingly, the doctor will go ahead and administer intravenously the TPA or the clot busting agent to save the life of the patient with ischemic stroke. Ruling out a brain hemorrhage is a very important factor in determining the effective treatment for ischemic stroke, as I said, and being presented to your doctor as early as possible within the 4.5 hours is very important. Another type of management of stroke, and nowadays it's available, which is the thrombectomy. If the major blood vessel, if the large blood vessel of the brain is affected with a clot or a thrombus, after the doctor gives the patient the clot busting medication, that patient can go ahead with a thrombectomy procedure, and that is a procedure to treat, to take out the thrombus itself from inside the blood vessel. It's intravascular thrombectomy, removal of the thrombus from the blood vessel itself. So you can see there are few treatments that we can offer the patient and can definitely enhance the process of recovery from the side effects and the complications of a stroke, of ischemic stroke itself.